People do not believe that children have cancer, and yes, they actually do. Do you know that our malaria that we all know is actually an indirect risk factor to cancer in children? Welcome to my channel. My name is Dr. Ahmed. I'll be talking to you today about childhood cancer. This simply means cancer in children. Childhood cancer is about 1% of all forms of cancer. That means it is very rare, very aggressive, and with treatment, it can actually be cured as soon as possible. It is the most common cause of disease-related deaths in children. Unlike in adults, they are not linked to any lifestyle habits or environmental factors. Cancer in children can actually occur in any part of the body. The most common one is in the blood, which we call leukemia in about 30% of the cases, followed by cancer in the brain. Then we also have others which include the kidney, the bone, and every other parts of the body. Symptoms of childhood cancer. If a child is having persistent infection, or you have to treat fever for a long time that do not have a known cause, you should suspect childhood cancer. Unexplained weight loss, generalized body weakness, loss of appetite, bone pain that is persistent, or if there is any easy bruising on the skin or bleeding that do not heal, you should suspect cancer in children. If a child is complaining of headache for a long time, or a child is having seizure, that means abnormal jerky movements of the body, we should also suspect cancer. Risk factors of childhood cancer. Malaria has been shown to weaken our immune system, especially in children, thereby predisposing their body to a particular viral infection, which we call Epstein-Barr virus infection. This particular virus is actually a major cause to a form of cancer called Burkitt's lymphoma, which is quite common in Africa due to our endemicity of malaria. Then, exposure to radiation, especially pregnant women that go for scan, like X-ray or CT scan, they also predispose the children when giving birth to having cancer. Then smoking. People that smoke whenever their children are around, it is not a good thing. Because when you do this, you are predisposing these children to lung disease condition, which cancer is one of them. Factors that are beyond our control. First of it is genetic conditions. There are some conditions in newly born children, which when they have it, it predisposes them to having cancer. Then age. By age, you mean that there are some cancers that are common in infants, especially cancer of the nerves, and there are some cancers that are common in elderly children. Another thing is gender. Childhood cancer has been shown to be quite common in male gender than the female. Then having family history of childhood cancer. If any of the father or mother or any of the siblings have cancer as a child. How do we prevent cancer in children? First is a regular medical checkup. We should ensure that our children are taken to the healthcare facility as soon as they fall ill, so that if there's any infection at all, it can be treated as soon as possible. Another major thing is to control malaria. We can get insecticide treated nets where our children can sleep, and also to treat malaria with anti-malaria as soon as possible based on recommendation of the doctor. Also avoid smoking whenever your children are present, as this has been shown to predispose them to having cancer. If there is any genetic condition in the family that you are aware of, it is good that you go for screening so that any children you want to give birth to are not going to be having this form of disease condition. It is also important to also reduce your exposure to radiation when you are pregnant. Then lastly is to ensure vaccination. Thank you for watching me today. Kindly like and share.